Hi, I'm Dr. Scott Santamore.
And I'm Dr. George Vergu from RBK Pediatrics. Primary care when you want it, urgent care when you need it.
We made this video together for you guys. I'm in anticipation of your 6-year-old's well visit with RBK Pediatrics. We just wanted to give you an idea of what to expect and talk about some of the more important things that we talk about with the 6-year-olds here. So it's been another whole year since the last time we saw you guys. A lot to catch up on. Everything that's been going on in school, everything that's going on at home, their friends, any illnesses, any new allergies, any new medications, surgeries, hospitalizations, subspecialists. There's a lot that potentially went on, and we want to make sure that we have all of it and that we keep all of it so that we know all of it in the future so that we can take the best care of you possible. The growth curves are still by far the most important thing that we look at the visit, making sure your kiddos are growing and gaining weight properly. We review the appropriate development for the kiddos. And of course, we do a nice full physical exam. And then we talk about any lab work or vaccines that we may need. So what kind of guidance do you like to give for the physical development of the kids, Dr. Rogo?
Well, you have to encourage the children to have at least 1 hour of vigorous physical activity every day. I mean, that's on top of what's at school. And on Long Island, a lot of the children by this age, they're already enrolled in some either lacrosse or soccer, little league baseball, swimming. So that's really good. They have practice 1 time a week, twice a week, and a game once a week. And then if they just run around in their backyard at practice, that's really good. You should also have these children engage in, other types of activities. They're getting bigger, so they're going to be biking or skateboarding at this age, or the razor blades. But they should always wear a helmet when they do that.
Definitely.
Yep.
The sports, I think, is very important for the kids at this age. It teaches them that if they practice something, they can do anything they want to. Nothing is impossible. It makes life a lot easier for the kids when you get that mindset in nice and early for them. I'm a huge fan of the organized sports at this age. It gets them interacting and socializing. It teaches them the discipline, the practice. It's great for them.
And it also teaches leadership at this age and team mentality to work together to have an end goal. With the soccer game.
It is great for the kids at this age.
Yeah.
Along the same lines as the nutrition, making sure we're keeping their bodies healthy for them. We want to make sure we're giving them a nice, healthy, balanced diet. 6-year-olds are not fans of big, healthy, balanced diets. They like their McDonald's and their chicken fingers and their French fries and stuff like that. But we are the adults, and we know what's good for them and what's healthy for them and what's going to help them grow up big and strong and smart. And so keep giving them the foods that you want them to eat. If you do that, they will eventually start eating it and stop complaining about it. We still like to avoid the sugary drinks, the soda, the juices. The kids don't do anything with that calories. It just gets put right on top of their body there. The milk and the water is by far the best source of hydration as well as nutrition for the kiddos. Along the same lines, we talk about sleep hygiene. What's your advice for the parents at this age?
Well, children should be doing about 9 to 12 hours of sleep per night. They're getting a little bit older and more independent, and they may tell the parent when they want to go to sleep. So you should always try, even though they're 6, try to get them at a consistent bedtime, understanding that this is the time that they go to bed, and wake them up to go to school or whenever it is around the same time, because that establishes, the consistency of sleeping.
And along the same lines, the social and emotional development, again, we want to continue to encourage those positive relationships with the family. We want the kiddos being able to go to anybody in their family for anything they need when they need help with anything. We want them feeling comfortable doing that. We want them comfortable speaking to the parents, letting them know how they feel about things. But we also want to promote a little independence and responsibility as well. We can start giving the kiddos little chores at this age. Clean up your room, help us wash the dishes and stuff like that. And it helps bring the kiddos into the fold and kind of give them that sense of responsibility and independence as well.
Right.
As far as safety goes, what kind of advice do you like to give?
They're bigger, they're faster, they're stronger. They get into more trouble. So, starting with the car, because that's a common thing. Children are in the car all the time. They need to have the appropriate seat belts, car seats, booster seats. They're going to be riding their bicycles. They're going to be using their razors, their electric scooters. They're very, very fast. So they must wear a helmet.
Mm-hmm.
And they should not be going on, main streets with these bicycles.
100%. Accidents happen. And we call them accidents because we don't intend for them.
Yeah. And when they're playing sports, they have to wear the protective gear. A lot of the children, like with the lacrosse, they don't like wearing, chest protection. They should wear the appropriate protective gear because they did studies and they did find that it does help to reduce the amount of injuries.
Mm-hmm. Especially the head injuries, which we're learning more and more about now with the concussions and the post-concussion encephalitis and stuff.
Correct.
Yeah.
Yep.
We still recommend going to the dentist every 6 months. And we recommend giving the kiddos a nice fluoride toothpaste and encouraging them to brush their teeth twice a day, every single day.
And the multivitamins with fluoride too.
Yeah. And getting them in the habit of brushing their teeth every day now, that'll stay with them as they get older. So we were talking a little bit about encouraging the language and the behavior. In particular, the behavior, it's important to make sure that the kiddos understand the rules and understand where the boundaries are. When they cross those lines, punishment. Timeouts tend to be very effective in the kids this age. But so long as you're setting those clear expectations for the kiddos, they don't have any confusion when they get in trouble. They know exactly what's going on so that they can modify their own behavior based on that. They're also getting old enough that you can teach them more about the personal hygiene, about the taking the baths and the showers, and washing their hands, wiping their noses, covering their mouths when they cough. It takes repetition at this age, but very important. And if we do this now, we don't have to do it later. Can you talk to us a little bit about screen time, our favorite thing to talk about?
Yeah, screen time is becoming excessive time at this age because now they're getting the PlayStations and the other interactive video games and the phones. And, kids, I've seen children where all they do is talk about, you ask them if they play soccer, and they tell me yes. They're playing FIFA soccer on their PlayStation. That's not soccer. They should be playing outdoors. They should be doing physical activity. It keeps them well-rounded. They could play. I mean, they're kids, so they should be able to play some video games on the phone and watch TV and Netflix. But it shouldn't occupy your entire day. They should be doing their homework.
Right. After they've done the stuff that you want them to do, then they can go and do that stuff. Yeah. So vaccines. Thankfully, at 6 years old, this is a little bit of an easier age for the vaccines. Generally speaking, the kids are all caught up with their vaccinations. The 4-year-old is when they got that big slew of vaccines to start school. 5 is generally when we catch them up on anything they may or may not be missing. So 6 tends to be easy. If we're in the winter seasons, we highly recommend the flu vaccine for all of the kiddos. And generally, we don't need any lab work at this age either, unless we're looking for anything specific. So this tends to be a little bit of an easier visit for the kiddos.
Yes.
So that's our video here. It's going to be another whole year before we see you again with your 7-year-old. But remember, we are always around for you, and we're here to help you with anything you need. So call us. We have doctors on call 24/7. We are always available. We would much rather you call us with questions than try to look online and get answers for things. We look forward to seeing you for your appointment.
And I'd like to remind everybody that what RBK Pediatrics stands for, primary care when you want it, urgent care when you need it.
Thank you. We look forward to seeing you.